Sarcoma is a rare but life-threatening cancer that endangers the lives of young adults between the ages of 18 and 40. Many of the patients diagnosed with sarcoma in Quebec are treated at the MUHC. SaRC-Q is a network of doctors uniting specialists from across the province to give patients access to more treatments. Dr Ramy Saleh is a medical oncologist at the MUHC and the medical director of oncology clinical trials at the Research Institute of the McGill University Health Centre. Thank you so much for joining us, Dr. Saleh.
Thank you for having me.
Let's start with sarcoma. What is it?
Sarcoma is a very rare and complex type of cancer. It mostly involves muscles, bones, blood vessels, or even nerves.
And how many patients are diagnosed with sarcoma in Quebec every year? I know we mentioned it's rare, but what is rare for you?
So rare for us means there's about 300 to 350 new cases of sarcoma a year in Quebec. In Canada, it's around 1,000 in total.
And when someone is diagnosed with sarcoma, are there symptoms or signs that they've gotten that they're reaching out and saying something doesn't feel right, and then you're able to diagnose that?
So most of the time, it is found by mistake. We call that incidental. If, for example, it is present in the bone, people can present with severe bone pain or some muscle pain in nature.
And who is most vulnerable? Again, I mentioned in the introduction, it's 18 to 40. Why does it target that age group?
So we have two major age groups that we see. We have what we call the adult and the young adolescent, or the AYA. Those are between the age of 16 and 40. The sarcoma is mostly located in the muscle or the bones in that category. We also see it in patients above the age of 60. Sometimes it's because they received previous treatments. For example, like radiation, it can cause sarcoma later on in life. But those are the two big bulks of patients in those two age groups.
And is there a predisposition to getting sarcoma? Is it something that could be genetic, or are there certain people that are more vulnerable to this specific type of cancer?
It can exist that there is a genetic component to it. However, it's extremely rare. We're talking less than 2% of all the sarcomas that are being diagnosed.
And if you are diagnosed with sarcoma, what is the treatment, prognosis? Is it one of the tough cancers to beat? Tell us a little bit about that.
Yeah, that's an excellent question. So in sarcoma, the treatments are divided into two. So if you have what we call local disease, which means your cancer did not spread anywhere else, treatments are mostly surgical in nature, plus or minus chemotherapy and radiation therapy. If it has spread to other organs, that the treatment is complex chemotherapy. What you mentioned is true. It can be intense treatments. For example, if it is located in a bone, unfortunately, most of the times the surgery does require an amputation of that area, and hence it becomes a little bit more aggressive in nature, the treatments.
So it sounds like it's a challenging cancer to face.
It is a very challenging cancer because the surgeries are aggressive in nature, and sometimes the chemotherapies can go on and on for months at a time. We can speak up to 6 or 9 months at a time.
Wow. Now we're speaking to Dr. Ramy Saleh. We're talking about sarcoma. Now, Dr. Saleh, you're working on a project with another doctor I'm a huge fan of, Dr. Nathaniel Bouganem, to form the Sarcoma Research Consortium Quebec, which is being known as SaRC-Q. Tell us about this consortium.
So because the cancer is very rare in origin, we wanted to make sure that patients who get diagnosed in the periphery in community hospitals get a fair chance of being seen by the specialists. So we came about medical oncologists who know sarcoma and who treat sarcoma from 10 different hospitals so far, and we all agreed to share our knowledge in order to provide the best care possible in the province for this very vulnerable population with sarcoma. Those doctors will not only provide their expert opinion, but will also make sure that the patients get access to cutting-edge treatments or clinical trials.
Now, how will this... you mentioned that there are doctors joining across the province of Quebec. Are you planning on expanding it to Canada or potential international specialists? Is that the goal or the vision down the road?
I think the first thing is we want to ensure that we have a very solid foundation in our province. Definitely expanding is an option, but at the beginning we want to make sure that the other hospitals also join forces with us. Our main priority is to make sure that all the patients who are diagnosed with sarcoma know about the research that is ongoing in the province, know about all the clinical trials, because once you have advanced sarcoma, it's extremely important that you try to get on a clinical trial if there is one available.
Right. So this is something that actual patients can interact with? You have a website that's up. Tell us about that, how people can get involved, how patients can see what you're doing.
Correct. So this is a non-for-profit. It means it's us doctors who put time and effort into this. We created a website called SaRC-Q.com, which stands for the Sarcoma Research Consortium of Quebec. On that website, you have a description on who we are. You can even see all of our faces and where we work and what's our specialties, so you know exactly where we're spread around in the province. There's a tab that lists actually all of the clinical trials in sarcoma in Quebec. And to my knowledge, this is the only website in all of Canada which lists all of the clinical trials in a province for a certain type of cancer. So it's very transparent for the patients to know. There's even an email if somebody wants to reach out to us or get in touch with us. It's also a place to encourage pharmaceutical companies to bring those cutting-edge treatments to our province and to our patients.
I want to mention that website again, so if anyone's listening to this who has sarcoma or a loved one with sarcoma or was just interested in helping, it's sarcq.com. And people can also, interestingly, donate when they're on that website. If they're feeling inspired, they can actually help. You mentioned that it was all the doctors who are putting, your own effort and time into this. People can get involved.
Correct. I highly encourage everybody who's able to donate to try and donate, because we want to ensure the longevity of this project to make sure that we're able to expand and provide the best service for those patients.
We're speaking with Dr. Ramy Saleh, who is a medical oncologist at the MUHC, the medical director of the Oncology Clinical Trials at the Research Institute. Tell me a little bit, Dr. Saleh, before we wrap up our conversation today, what are some of the benefits of specialists working together like this? Because it feels like it's such a positive yet, impactful way to do your work.
The main reason why we're doing this is so we can all share our expertise. This is a very rare cancer, which means a lot of the doctors that see patients or diagnose patients with sarcoma might not have that much of expertise. And the reason why we wanted to come all together is so we can share, the years of experience that we have in order to provide the best, surgical option or chemotherapy option for the patient, in order to make sure that we really gave them the best of a treatment option. And if there is a trial or a cutting-edge treatment, they can actually get access to it. Because at the end of the day, if they actually get a better treatment, that could affect, their quality of life as well as the quantity of their lives.
And ultimately, it's all about that. Dr. Ramy Saleh, thank you so much for joining us on Health Matters. I want to give that website one more time. It's www.sarcq.com. Thank you so much, Dr. Saleh.
Thank you very much for having me.